Hi, I'm Dr. Flora Waples, founder and medical director of RESTOR Medical Spa, and today we're going to talk about the top 5 most common questions that people ask me about laser hair removal. The most common question that people ask me about laser hair removal is it going to work for me? That's a great question because there are some nuances to this. Generally speaking, laser hair removal works by heating up the hair follicle, leaving the rest of the skin alone. It's called selective photothermolysis, if you want to know. The way I think about this is it's like if you have a parking lot full of cars. You shine light on the cars. The black cars get hot, the white cars don't, right? The more density of pigment you have, and the more different that pigment in the hair is from the background skin, the easier it is for the laser to do its job without burning your skin. The best candidates for laser hair removal are people, honestly, that look a little bit like me. Dark hair, fair skin. The closer in color the hair is to the skin, the harder it is to make the laser work. Very fair blondes, it's going to be difficult to remove that hair. Redheads, likewise. There's not very much pigment inside that follicle. It's very difficult to remove red hair. And if the hair is gray, unfortunately, we will not be able to remove it with a laser because the gray hair is actually transparent. There's no pigment in the follicle at all. So the further the difference is between the color of your hair and the color of your skin, the easier it will be to remove it. The second most common question I get asked with laser hair removal is, well, how does it work? I love the analogy of shining light on a parking lot full of cars. When you shine sunlight on the cars, the sunlight will hit the cars, and how much of the sunlight is absorbed depends on the color of the pigment in the paint. A black car will absorb all the sunlight, gets hot really fast. A white car will reflect all the sunlight. It'll still get warm, but it's not going to get hot like a black car will. The same is exactly true of your skin. When I shine a laser on somebody's leg or arm, if I'm trying to remove hair, the hair follicle has a lot of pigment in it. It will absorb that laser light and it gets hot. And it gets hot enough to destroy the follicle, while the background skin, which does not have as much pigment, is unharmed. So that's how laser hair removal works. The third question I get asked about laser hair removal is, how many treatments am I going to need? That's another great question. Generally speaking, somewhere between 8 and 12 is going to remove about 90% of your hair. But what's important to remember about laser hair removal is you're going to get to a point of diminishing returns. Why is that? Only 1/3 of your hair is actively growing at any given time. 2/3 are not. The laser can only target the follicles that have a hair shaft inside of them. Only the ones that are actively growing are going to be removed. So the laser will remove 1/3 of the hair each time. So think about this. If you've got 100 hair follicles, your first treatment, you go from 100 to 70. That's amazing. That's a great difference, right? If you've only got 10 follicles left, you go from 10 to 7. That's not as big of a difference. What I'm trying to say is your 10th treatment will reduce your hair by 3%. Your first treatment will reduce your hair by 30%. You're going to get to a point where additional treatments, while they are still working, are not going to give you very much of a difference. So when people ask how many, I tell them 8 to 10. Now, the other thing that's very important for people to know is hormonally driven hair is always going to come back. What's hormonally driven hair? The stuff that happens when you hit puberty, right? Underarm, bikini, face on men. Those areas of hair are going to regenerate themselves as long as you have active hormones in your body. But it does it very slowly. Generally speaking, a bikini area will grow back in about 10 years. So, you do your initial series, you do 8, 10, 12, you take out 90% of your hair, you're going to need to do touch-ups on the hormonal areas once every couple of years, or maybe just a series 10 years later. Know that that's going to happen. That's just part of the realities and the physiology of the system. The fourth question I get asked about laser hair removal is, does it hurt? Well, the answer to that is some. It does some. Every hair follicle in your body has a nerve attached to it. That's why it hurts when it gets pulled out. That's why you can feel it when it moves. When we destroy that hair follicle, we're going to be destroying that nerve too. And yes, that can be uncomfortable. Generally speaking, the amount of discomfort someone has depends on how dense the hair is and how dark the hair is. Darker hair absorbs more heat, it's going to be more uncomfortable. The more dense the hair is, say on an underarm versus a leg, underarm is going to be more uncomfortable because there's going to be more heat packed in there. We do offer our patients nitric oxide, which is laughing gas, the same thing they can give you at the dentist, to help with that discomfort. The last question that people ask me about laser hair removal is, how long is it going to last? The answer is hormonally driven hair, underarm, bikini, face for males, it's going to last about 10 years, and then it will slowly start to grow back. The non-hormonally driven areas, legs, arms, backs, again in males, those will pretty much last forever. But the areas that are hormonally driven are going to want to grow back until you hit menopause, and then the growth stops. So how long it lasts depends on what area you're treating, and those are the most common questions that I get about laser hair removal.